Thanks. So our next session is titled, What It Means to Be a Caregiver, Understanding Your Evolving Role. So being a caregiver can be both challenging and a rewarding experience that comes with many roles and responsibilities. And often these are on top of those that you had prior to your loved one's diagnosis. So in this session, we'll discuss the many facets of caregiving as well as the evolution of your role along the course of an illness due to a brain tumor diagnosis. We will discuss some of the challenges that are specific to caring for someone with an illness that affects the brain, how to balance your new role with your other life responsibilities, and ways to become an advocate for both yourself and for your loved one. Our speaker, Dr. Katy Peters, is a professor of neurology and neurosurgery and the director of supportive care at the Preston Robert Tisch Brain Tumor Center at Duke University Medical Center in Durham, North Carolina. In addition to her role as academic neuro-oncologist, she's also the co-host of the Brain and Life podcast for the American Academy of Neurology. Please welcome Dr. Katy Peters.
Thank you, Margaretta, for that lovely introduction. And I want to thank the ABTA for inviting me and for this first session on what it means to be a caregiver and understanding the evolving role. We'll get started with the presentation, but just to give you a format, I'm going to just go over some slides. I hope it generates some questions, but we also will hear from a caregiver about their journey. These are my disclosures and support. And again, the objectives today are to identify the various roles and responsibility of a caregiver along the continuum of care. Next is to determine how to balance that role as a caregiver with what else is going on in your life and those other responsibilities. And I think, again, also very important is to develop effective communication skills to advocate for your loved one and yourself while discussing the diagnosis and sort of the journey with those healthcare providers. So I think about quality of life and what it means for the patients with brain tumors. And quality of life is really defined as a degree to which one enjoys the important possibility of one's life. And we bring into it sort of three aspects. One is really who we are, the being. Next is belonging, sort of who do we belong to, where do we belong with our families, our communities, other groups. And then the next would be becoming, sort of what is in our future. And I look at our patients. These are just an example from one of our 5Ks. I know that they just talked about the fundraisers for the ABTA 5Ks. I would really encourage everyone to do that. But this is just an example of our survivors. And you can see this really indicated by the, they're wearing little tags that essentially say, I'm a survivor. And you can see these here. And we think about sort of the quality of life and the uniqueness across like different types of patients, that the quality of life and what they would experience is going to be different. But I want you to think about, we know that over 94,000 Americans received a brain tumor diagnosis in 2023. So we want to think not only about the quality of life of the patients, but also the quality of life of those caregivers. And that's what we're going to focus on today, of exactly what does that mean. So we're going to highlight the caregiver. So in addition to identifying our survivors, we also give little badges to our caregivers to show how important they are and what it means to be a caregiver for a patient with a brain tumor. So caring for a loved one diagnosed with brain cancer is an emotionally challenging journey, and it requires compassion, knowledge, and really a great deal of support. And it really varies from caregiver to caregiver what their experience is. And it can also change over the patient's clinical course. And I hope you can see that this is an example of some great pictures of different types of caregivers, whether maybe you're a husband, maybe you're a wife or a sister. Also, what if you're a whole caregiving family? for a loved one that's battling brain cancer, or what if you're a child, even a small child. So it really can vary based on what stage the caregiver's life is in, what their relationship is with that patient that has a brain tumor, and what's going on with the patient's clinical course. So what do we know about the dynamics of caregiving for brain tumor patients? So caregiver relationships are so important. And while we have many different faces, the roles are really the same. So this is data from 147 caregivers, and they looked at the relationships between the caregivers and the patient. And you can see most of them represent a spouse-partner relationship, but there can be different ones such as child, parent, friend, sibling, and other family. And I would also mention that you can have different types of caregivers across the continuum. You can have maybe a patient that also has a caregiver that could be their spouse that maybe is taking care of an elderly relative or an elderly parent, but then also a child with maybe special needs. So it could be that that caregiver is having to juggle a lot in the terms of caregiving roles. So depending on the stage of the disease, the role and needs of the caregiver will change. And again, it starts with that detection and diagnosis, then sitting down and sort of developing a treatment plan based on that diagnosis. And then patients endure treatment, whether it's surgery, chemotherapy, radiation, maybe they're on a clinical trial, maybe they're having to travel for that treatment, and that has a lot of intricacies that were required by the caregiver and the patient. Next is, was the treatment effective? What's happening day to day to monitor that treatment? Are we going to appointments? Are we going to labs? Are we going to other facilities? Are we having to get MRI scans? Next is, what happens when the therapy maybe doesn't work and you have to change therapies? And then you have to have a new plan. Maybe now you're seeking out second opinions and the caregiver is having to be involved in those, or maybe a second or even third opinion. And then finally, survivorship. What about our patients that become long-term survivors? What's happening to them after they've received these treatments? Also, what about end-of-life planning for patients that maybe are in that stage? Now, these are just some quotes from either caregivers of my own patients or some caregivers that I've spoken to. So one that I thought of sort of at the very beginning is it was my wife who sought out other options. So sort of first at that diagnosis, detection, and treatment plan development. Another quote that I heard recently from a caregiver, I wish someone had directed me on the little stuff, on how to do stuff physically. And this could be sort of really in that treatment effectiveness stage, maybe also what's going on with like physical therapy or the functional abilities of the patient. Another one that I thought about sort of in the survivorship stage is a quote that patients are living long with less debilitating treatments. So people are living longer and they aren't having maybe some side effects. But on the flip side, I also have a quote from a parent that said, I don't know if we should have done radiation with these effects. So I think looking at these quotes, you can see how across the continuum, the roles and needs of the caregivers are dynamic and will change and evolve. So in a study of 67 pairs, we found that challenges in cognition can really impact caregivers. And the orange bars are just saying, what is the prevalence of symptoms in the patient? And in the green areas, or in sort of that teal area, is what is the impact of those symptoms on the caregiver? And we can see the two that are probably the most common are memory issues, again, very prevalent, but seem to impact our caregivers a great deal. And then also changes in personality and mood also are high up there. But remember, the factors can vary based on the location of the disease in the brain, the extent of the disease in the brain, and also the treatment modalities that we're giving to our patients. So for example, patients that get radiation may have more cognitive side effects. It may be patients that aren't getting radiation, maybe they have a different type of side effects associated with it. Also, I want to say that the age of the patient is also critically important, particularly if you're giving maybe a treatment to an elderly patient versus a very young patient. And in a study of 25 caregivers at different stages of a brain tumor's sort of clinical journey, there were themes across family caregivers. And I hope that these themes resonate with you and if you have questions about them. So the first is really family issues. And this could be, what is your relationship? Are the roles changing? Does that patient now need help with activities of daily living or even a higher level of nursing duties? Now, is there problems with employment and financial issues? We see this with several of our young patients with low-grade glioma. They may have been starting on a path to start careers or start schooling, but because of their brain tumor diagnosis, that can get waylaid. And I think a very important thing is also balancing the needs of other family members, particularly for people in that sandwich generation, where they may be taking care of a child and an elderly patient. And now if their spouse is diagnosed with a brain tumor, that adds in another sort of situation for that caregiver. Now, managing challenging behaviors, this is really the gamut across cognitive changes and personality changes, which we saw on that last slide. While some of these challenging behaviors can stem from the brain tumor diagnosis itself organically by the location where it is in the brain, we have to remember that several things that we're doing to patients can also cause these problems. So it may be highlighted during those particular times. For example, radiation can affect patients' cognition. So you can imagine maybe during radiation or maybe a late effect of radiation, those patients may have cognitive challenges. Another one that I think of that's very important for our patients and their caregivers is the changes in our personality and depression. These can be seen with the use of steroids, which are almost a ubiquitous medication in our patient population, but also anti-seizure medications. Many times in clinic, I'll ask, a patient, how are you tolerating your anti-seizure medication? And they're like, I'm tolerating it just fine. And then I'll ask the caregiver and I get a very different story. And I'm sure that is something that can resonate with many of the listeners today. Also, other themes across family caregivers were, what are your own personal feelings? And I use sort of this emoji slide because I think it does represent all the types of emotions that we can have as caregivers. So anywhere from like being anxious and depressed, or all the way just to feeling overwhelmed or feeling guilty or resentful of the situation. And then you add on top of that, having to navigate through the medical system. And I think this is so important. I like this diagram because it just shows all the ins and outs of having to navigate a medical system. And then you add sort of like a portal on top of that, a computer-based portal, and going to all the appointments and managing that care. And remember, those patients may not be able to attend to those tasks anymore. So it's really on the onus of the caregiver to manage all this and have to understand the medical system, not only from a practical perspective, but maybe a financial perspective too. So these are very common themes. So what about the caregiver journey? How does it change? And we're talking really today about the evolving role. And I like this graphic because what it sort of highlights is a new caregiver, a caregiver through the continuum of illness, or maybe they've been a caregiver for some time, versus a caregiver at the end of life. So what kinds of roles and needs at each of these stages are there? So first is, for a new caregiver, really it's going to involve the need for understanding the diagnosis and the recommended treatment. And I would say that also something that I've heard other caregivers mention is they really want to know about expectations. And even at this new point of contact for the caregiver is that they do want to know about the diagnosis, the recommended treatments, but also from the provider what to expect. And I think this is really important. And you can see how the ABTA could engage caregivers in all aspects of this continuum. Next is the caregiver for some time. This is really the adaptability stage, that it doesn't look like the situation I was at the very beginning, but now my loved one may have changed. Maybe this is because of treatment. Maybe this is just the natural disease course. Maybe we're moving towards a survivorship stage. Maybe we now have recurrent disease and we have to manage that. And maybe now we need a second opinion or go to a clinical trial. There's so many facets of this sort of in-between stage. And you need to have coping skills. And I think this is where self-awareness really needs to be highlighted. Of course, it's important across the whole continuum, but I think in this stage, you really need to make sure that you're aware of yourself and you're taking care of yourself in the best way you can. And this is also crucial, that you know how to ask for help. You know how to reach out, and it may be reaching out to organizations like the ABTA, or reaching out to your providers, or maybe the social worker that's involved, or family members and friends. And then the caregiver at end of life, I think the real challenging thing here is you have to balance hope and really realistic expectations, and what is going to happen to that loved one at the end of life. And it could be now that this is when hospice care comes into play for those patients and the caregiver. So what are common caregiver roles? And I sort of broke it down into several different things. The first is care coordination. And I looked at some surveys and some work that the AARP, now this is all caregivers, not just caregivers of brain tumor patients, but 46% of caregivers are involved in complex care coordination tasks. This is like coordinating appointments, providers, and services. And so this can be very challenging, but a needed role of caregivers. The next is financial related issues. We do know that caregivers of cancer patients experience a greater financial burden in compared to other types of caregivers, and that 56% of family caregivers are managing health insurance, government benefits, and can be very, very challenging. Also, in a study of 167 pairs, more caregivers who were caring for patients that had a lower ability to do the daily activities of living for their own selves, were finding that they were the ones, not other people, that they were the ones in the homes that were aiding their loved ones with those activities of daily living. So you can see that there's the coordination, that's a whole job, the financial related issues, and then also those activities for daily living. That is a lot to put on just even one person. So what do caregivers want from us, the providers? So they want medical guidance. And as I mentioned before, they want to know about what to expect. So in a study by the National Alliance for Caregiving, upwards of 72% of caregivers want to know more about the treatment regimens. They want to know about managing side effects. They want to know about the complexity of medical issues, and they want to know about outcomes and expectations. They also want us to know, us providers, that they need support, because caregiver burnout is, and we're going to talk a little bit more about this, is significantly higher in people who are caring for a person with a glioma in comparison to other types of cancers. So our caregivers are really experiencing a high level of burnout because of the situation those patients are in. The next is the caregivers want essentially things like these sessions, like this session sponsored by the ABTA. They want to learn about coping strategies. They want to learn about personal care skills. They want to have training. And even some want to know how to do formal medical and nursing tasks. So what can caregivers do? And what caregivers could do is identify and make yourself known to providers. And you want to be an advocate, not only for the patient, but also for yourself. And I would say that I'm really lucky. I get to take care of brain tumor patients at the Preston Tisch Brain Tumor Center. And this is a picture of me with one of my patients in clinic. And what I want you to notice is there's someone with a hat sitting behind me as I'm talking with my patient. And that is her caregiver. And even though what my job is to take care of my patient, we need to focus on the caregiver. Bring them to the front, ask them, engage with them as providers. And caregivers need to engage with us also as providers. So caregivers, make sure providers invest time with you during the clinical visit. Ask about expectation for future outcomes and challenges. Also, what's wonderful is I work with an amazing large team at the Brain Tumor Center at Duke. We have nursing staff, advanced practice providers, which are NPs and PAs, social work, a child life specialist, patient navigators, financial care counselors, neuropsychologists, psychologists, and even legal services, and our wonderful pharmacy staff and professionals. And I actually know several answers to questions that the caregivers have, but I don't have all the answers. And so it's really this great depth of staff and providers that we have that can get access for the caregiver to get access to them. And so I think it's really important to make sure that you can find other providers and other specialties that those caregivers can engage with. Now, caregivers can experience distress, and several of this work was done by my colleague Steve Keir at the Brain Tumor Center that just looked at, along with the other people, Saria and Reblin, that looked at how the caregivers of brain tumor patients do have high levels of distress that impact their quality of life. And being a caregiver can be associated with increased psychosocial distress, anxiety, and depression. And let's talk about that. Psychosocial distress is essentially a fancy term for essentially burnout. And 23% of caregivers felt that their caregiving responsibilities not only was causing them an emotional burnout, but would actually cause them that their own physical health was suffering because of being a caregiver. We have to remember that this is very common, and these are sort of the signs of burnout, sort of exhaustion, isolation, having escape fantasies, irritability, frequent illnesses. And in a study by Stibe and colleagues of 50 caregivers of patients with brain tumors, anxiety, depression, and increased stress levels were apparent for those caregivers. So what can they do? So my colleague Steve Keir at the Brain Tumor Center at Duke essentially asked our caregivers, what if we had interventions, what would be appealing to you? And the caregivers were very open. It's like, we want help. So exercise, massage, coping skills, learning how to meditate can be very beneficial for the caregivers. And so managing caregiver burnout and distress is key. I would say ask for help, ask providers, friends, and other social support systems. This is actually a picture of a candle sort of burning the candle at both ends. I think it really typifies what's happening to our caregivers so many times. You want to find a community. I think this is really important, particularly what we're doing today with the ABTA. You want to look to local, regional, and national organizations such as the ABTA. You want to make time for self-care. You want to exercise, you want to eat well, sleep well, make sure you go to your own healthcare appointments. And for some of my caregivers, consider respite care. Now, this is a temporary break that involves, it can either happen in the home, maybe the patient could go to a skilled care facility or an adult care center setting that can be beneficial to them. You can even ask other family members, one sort of informal way I've seen my caregivers do respite care is they'll have a relative come in and take care of their loved one for a week. And that they have a rotation, and that can be beneficial, but then also builds a community around the caregiver and the patient, which I think is really important. Now, organizations that are helping caregivers, I'm sure there's a very long list, but this is a group that I reach out to personally and then also refer my patients to. So of course, the American Brain Tumor Association, the Brain Tumor Network, and the National Brain Tumor Society, and the Adam Finacki Brain Fund. This is actually was created by a caregiver of a brain tumor patient, and she has a great podcast called Resilient People. It's based out of Canada, so I'd really encourage all of you to look into that, because it's not just about being a caregiver, but also being resilient. This is the disclaimer for the talk. And I just want to say thank you to everybody. Thank you to the ABTA for inviting me and for the organizers of this conference. Of course, I want to thank our patients, and I want to thank the rich, wonderful community of our caregivers. I also want to thank the Brain Tumor Center Supportive Care Research Committee. Our theme is to creating a better everyday for all impacted by brain cancer. I also want to get a plug out there for my podcast and social media. You can listen to me really every week at the brainandlifepodcast.org. This is Neurology for Everyday Living, and it's really geared to patients and caregivers. And we had some recent episodes on a brain tumor patient, actor Craig Russell. He actually talks about how his wife was integral in him getting diagnosed and supporting him here still today. So a lot about the caregiver. And Dr. Sandeep Vaishnavi talked about the role of the caregiver in patients with traumatic brain injuries, which does resonate with the brain tumor population. You can follow me on X and also on Instagram. And that brings me to welcome our caregiver. Our caregiver voice is, I would say, first of all, a top-notch caregiver, but also I would say a good friend of mine, and it's Lou Dumas. Hi, Lou.
Hi, Katy. Good to see you. Thanks for having me.
Absolutely, absolutely. And you're joining us from Apex, North Carolina, correct?
Well, Perry now, but right next door. Yes.
Oh, right next door. Okay, great. So could you just introduce yourself to our group and tell us about yourself and also, I guess, your journey as a caregiver?
Yeah. So 17 years ago, my husband, Bob, was diagnosed with a grade 3 astrocytoma. And in the left temporal lobe, I find myself saying these things so easily now. And in fact, in some of the many times that we've had to rush him to the ED or whatever, people go, "So are you in the medical field?" And I'm like, no, just honorary, because I've learned all of this stuff over the years. But so anyway, yeah, it's been a 17-year journey, and there's been a lot of, it's been a roller coaster ride for sure. But I think what has helped the most is just how strong actually Bob has helped me as a caregiver.
And in addition to caring for Bob, you also have 2 girls, correct?
I do, yes. And you talked about the sandwich generation. So I actually when Bob was diagnosed 17 years ago, our 2 girls were very young. And so I had to sort of navigate how we were going to deal with this with young kids and daddy's journey. And then as the years have progressed, I had aging parents. Bob had aging parents that we also cared for. And so there's been a lot on my shoulders over the years, not gonna lie. But I'm doing my best through lots of support.
That's wonderful. And that really typifies that evolving role, that it changed, from the very beginning to sort of where you are now. And what have been some of the biggest challenges that you've had to, I guess, sort of encounter during this experience?
Yeah, so it's interesting because I think for me and probably a lot of other caregivers who've been sort of on I remember when we were first diagnosed, and I say we because when you have somebody who is diagnosed with any cancer, but a brain tumor, they're not the only ones that are diagnosed. It's the whole family that goes through this, especially the caregiver. You are right there next to them,
Mhm.
advocating with them and stuff. But for me, the biggest challenges I think have been the changes over the 17 years that we've gone through this. First, it's the utter shock of the diagnosis and actually having a doctor look you in the eye and say, your husband has a brain tumor. And that's shocking to the system. And just having to deal with that,
Mhm.
navigate it, help your kids navigate it, help your husband navigate it. And then, as these years have gone on, he's had some great moments and he's had some health hiccups. And we've had to go with the flow, deal with all these different stages that he's gone through. And it has been a roller coaster. But I think one of the biggest things too is that when you are a caregiver for a brain tumor patient, people don't get it. Unless you've been a caregiver, you just don't get what this journey is like. And I think sometimes there's been a frustration for me because just everyday life, people just will look at him. He had a resection, a year of oral chemo and 6 weeks of radiation. And after that, he appeared very strong and resilient, and he was, but things were different at home. He was very tired all the time. There was a lot of sleeping. Our family interaction was different. The dynamic in our family was different. And that's stuff that people didn't see. And they think, oh, you're fine. He's good. He's doing great, especially at the beginning part. And you go, yeah, no, it's not like that. And then you just go, it's not worth the struggle of explaining this to you. I'm just going to live and do the best I can to help take care of him.
Well, and you mentioned that like that people like, just didn't get it. Who do you think listened to you? Like, were there people that finally did get it?
Yeah, I mean, it's really the family, and I have really great girlfriends, a great support of girlfriends, and they got it because they saw me going through it. But it's just little things. Like, for example, we had young kids when Bob was first diagnosed, and they're in school, they're going to bring germs home, right? And our kids, it used to be pre-brain tumor. If they were sick, they got to lay on the couch, miss a few days of school, watch TV. But after Bob's diagnosis, things changed. They were basically quarantined to their rooms because we didn't want Bob to get sick, because what people didn't understand was just a simple cold one time sent Bob to the ED. Just because of his reaction to the germs. And so, those are things. I was a germaphobe. I became a huge germaphobe even before the COVID-19 pandemic. And I was the original germaphobe. And, I almost was made fun of for that, like, hey, everybody use hand sanitizer. And, it was kind of a joke what a germaphobe I was, but I was doing it to take care of Bob. I was trying to protect him the best I could.
So you knew about all those like wipes and masks before everybody else.
Oh,
You were
that was second nature to me. I was kind of like, oh, thanks for joining me on this ride, everybody. Like, the pandemic was kind of the way we had lived for a long time.
And you mentioned how that sort of part of your life changed. Can you give other examples about how life has changed since the
Yeah,
diagnosis?
yeah. So I think, and I want to say too, I remember when I mentioned how Bob has been so wonderful about understanding my role in this journey. And I remember at the very beginning, we were in the hospital after his resection. There was Duke is a teaching hospital, and there were probably 10 people around his hospital bed. And I remember him saying, listen, I have a whole team taking care of me, helping me get better. Who's taking care of my wife? Who's taking care of the caregiver? And I thought that was really profound that he recognized that. And so he's always made it a point to hey, what about Lou? Hey, take care of Lou. So that's been really special as far as our journey is concerned. But over the years, you were talking about the changes. The family dynamic has changed. The roles have changed, especially lately. You mentioned the radiation, and he has had some cognitive changes because of the radiation therapy he said he has had. And, they told us, oh, you might see some late effects, like maybe 9 to 10 years down the road. Sure enough, almost to the date, we started seeing some changes with him. And, it went from, I had to start paying the bills again. Bob was very actively still working for a long time after his treatments, and did very, very well up until about 4 years ago. He stopped working, and then about 2 years ago, he had a pretty severe stroke. And so things have changed. But, there were seizures, there were little incidents, and it was so new in a sense, a brain tumor patient, following their journey was so new in some ways that actually I remember you, Dr. Peters, I had asked you, like, Bob's having some weird feelings up here in his head. And you're like, yeah, we're noticing that with a lot of our patients. This is a relatively new thing. So, we were embarking on that too, where it was somewhat of a pioneering effort. And so the changes, we've evolved over the years, but he went from being the breadwinner to now I'm the breadwinner. I pay all the bills, I take care of the house, and he still has a really good quality of life. And maybe he just wants me to do those things so he doesn't have to do them anymore. That might be a Bob thing. No, I'm kidding. But yes, absolutely. The roles have changed significantly. And I also want to say that as a caregiver who is a spouse, like after Bob just had a stroke a couple of years ago, he did have some right side paralysis. And so when he walks, there's a limp. And I have a tendency to immediately, when we go somewhere, I grab his hand, and I have to remind myself at times, don't just hold his hand to steady his walk. Hold his hand because you're still his wife, because the lines can get blurred sometimes that I always feel like, oh, okay, I'm the caregiver. Did he get his medicine? Did he eat? Did I check his diabetes sugars? Did I do this? And I have to remember sometimes, like, that's still my husband. I need to have conversations with him. I need to just hold his hand. We need to just sit and watch a movie sometimes. So it's kind of always a daily challenge. It's always there.
Yeah. So, and I think that's so true, because I think, you have to balance sort of caregiving, but then also being a spouse. And that can be a challenge. And I know one of the things is that Bob is so fun. And that's one of the things you want to have, fun with your spouse. How do you do that? What tips would you give this audience?
So it's funny because I was just thinking about this yesterday, and I thought, if I had to tell somebody now, 17 years into this journey, I would say, take the trips, do the fun stuff, because we're at a point right now where, again, Bob still has a really good quality of life, but is not active like he once was. And, but, have the family reunions, do the fun stuff, go on the trips. And I'm really, really grateful that we did that all of these years, that we didn't hold ourselves back from doing that. I have to share a really funny story. When right after Bob had his diagnosis, he had finished his treatment. I remember one of the doctors at the Brain Tumor Center saying, okay, like, go live your life, go. And I don't think they quite meant it, but he went back to riding his motorcycle. And I remember that first family vacation that we took after we had dealt with the resection and all of that. And we went to a water park. And I remember being so nervous the whole time. And, you're climbing up a bunch of steps so that you can slide down the water slide, on the tube and stuff. And so the girls and I and Bob, we were all climbing up the steps to do that. And you're waiting in a line for other people. And I remember a bunch of kids, young kids, just staring at Bob's head because you could see the big scar on it and they were scared. And of course, Bob in his humor just immediately, because I said, oh, the kids are like looking at you. He immediately turned and went, to the kids. And so to your point, Katy, we have definitely, we're very faithful. And I feel like God gives you your gifts to handle everything that you're given in life. And one of them has been humor. And as hard as this has been over the years, we do try to remember the humor in all of this and to just try to have fun. So take the trips, make sure there's laughter, do as little things like playing. We would do family game nights and we would do family karaoke nights with the kids and stuff. Go on the date nights, do all of that.
I love that. That's great advice. And I'm going to ask you a little bit sort of about you. What do you do particularly to take care of yourself? So just you. It sounds like you're taking care of your relationship.
Yeah. And early on, I remember someone saying, hey, listen, pace yourself. This is a marathon, not a sprint. Thank God. And I guess I didn't really quite get it. I was running on adrenaline. I was, my stamina was really good. And so right about 4 years post-diagnosis, Bob was good. Life was going well. And I don't know if maybe I exhaled for the first time, but I had my very first panic attack. And I didn't know what it was. I had never experienced that before. And I immediately, once I calmed myself down and kind of got over it, the next day I went to see my doctor. And that was one thing, is I have a really good relationship, not just with Bob's doctors, but mine. And they know what I'm dealing with, even with my dentist, because I remember him saying at some point, okay, girl, you're stressed. I can tell because you're cracking teeth and your jaw is so tight. You're literally cracking. We've had to crown all of my teeth. So anyway, I know that's just a little tidbit that maybe you didn't need to know about, but it's just part of my journey again, but I did recognize about 4 years in that I better make sure that I'm taking care of myself, because these girls are depending on me and my husband is depending on me. And I want to stay healthy through this. And so I've been really good about my regular checkups. But I am also a really big proponent of talk therapy, of counseling. I don't know if I could have gotten through all of this with just someone to just tell it all to, because Bob and I have a great relationship. We have a great marriage, and we always would tell each other. And then I thought, it's not really fair for me to throw all my concerns on him. He's already dealing with this disease. I don't need to do that. So I felt like talk therapy was a really big deal. And I'm a huge proponent of that, just getting counseling. But I also have great girlfriends who have supported me, and they give me their ear, and they let me cry, and they let me laugh, and they make sure that I'm having a good time in life. So that's been a big part for me, is taking care of myself. And I will not lie, there is chocolate hidden throughout my house, because at any given moment, I may need to just grab some chocolate to get through and take a deep breath.
I love that, Lou. I think we all deserve a little bit of chocolate, and I think that all helps us get better. And one of the things I think that was key that you mentioned, and I just want to say it one more time, is that you shared your husband's experience with your own providers. So they sort of had a context. And I don't know if everybody does that it's almost like you did the next step in sharing. You're like, well, this is what's going on with me because of this. And so I think that's important. Now, one of the things that I think you do great is you really know how to advocate for yourself with providers. Can you tell us sort of like how you do that, and any tips for our caregivers?
Well, and thanks for the compliment. I'm always trying to do the best I can for Bob. I always try to put myself in his shoes. Like, if the tables were turned and I was the patient, what would I want him to do for me? I ask a lot of questions. And I also am pretty insistent on some sort of communication that I can have with a doctor. So for example, I'll share with everyone, Katy, that, I have scanxiety. It doesn't matter that we're 17 years out.
Yep.
If we have a scan, an MRI, I'm scared. I am scared and I am praying. And Dr. Peters knows that, and she's very good to me. And so I don't always have to wait the next hour after the MRI to go see her in the appointment. She will sometimes email me and say, hey, it all looked good. I'll see you soon, and she just gives me that so I can breathe again. And so my blood pressure goes down a little bit. But I noticed right away, right after Bob was diagnosed, I realized I was thrust into this position. I remember, I mean, literally, as soon as we came home from the hospital, here is a story I want to share with you. He had the staples, stitches and stuff in his head from the resection. And everybody had said, don't touch it. Don't touch it until you come back. We will make sure we clean it. Don't touch it. Don't let it get wet, And so there was a home healthcare nurse that came to our home. It was part of the insurance policy, right? Like they had to come for this visit. So she came, and this is somebody that is not in the loop, doesn't understand. We're having to re-answer a bunch of questions. So it was a little frustrating. And then the next thing I see, she's going into her bag and getting ready to clean and I go, no, 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 you can't touch that. You can't touch that. The doctor told me not to touch that wound until we go back to Duke. Please don't touch him. And she was like literally heading for his head with some wipes to clean it. And I go, please don't touch it. I've asked you twice now, don't touch it. And then I did have to kind of gently slap the hand away. Okay. And this was a moment for me where I realized, oh, wow, I'm going to have to be his voice at times because he was so exhausted. He couldn't do that. And there have been times that he's been in the hospital for one episode or another, whether it was seizure or stroke or something, that, I had to be his voice. And I take that job very seriously. I also feel like it's a privilege for me to take care of him. So I think for me, it's just asking a lot of questions, and I try to think ahead. So for example, when a doctor tells me we're putting him on this new drug, it's going to have to be this, and this many hours, I'll go, okay, so wait, do we have to eat with this drug? Do we have to, blah, blah, blah. Will there be an interaction? I go through all of that now, years later. But so it's been an evolution for me too, as a caregiver.
Well, Lou, I think you do an outstanding job. And I think everything you've shared with our audience is just amazing. And now they have some questions. So we're going to turn it over to the questions, but thank you again. Thank you for everything you do for Bob. Thank you for being a great partner with me I guess we're a provider caregiver partnership.
We are, and we both love designer handbags, and oh my gosh.
Yeah. Oh, absolutely. So we're going to get some questions.
Yes, thank you so much. Just as a reminder for our audience, if you do have questions that you want to ask either Lou or Dr. Peters, please type and submit it using the Q&A button, and we will answer questions as time allows. So one of the first questions we have here is asking for support groups. And this attendee is asking specifically if you are aware of any support groups for family members. So not just the one who's doing the primary caregiving, but other family members who are impacted as well.
So within our cancer center, there is a support groups for caregivers. I think one of the challenges for the brain tumor patient journey, a lot of times it can be very different from patient to patient. And so sometimes it should be more tailored around the sort of the specifics of the diagnosis. And we also have to remember there's, childhood brain tumors, there's adult brain tumors. There's many patients that some of them get surgery, some of them get radiation. So I think, yes, there are definitely support groups for caregivers. And I don't know if Margareta, if you're there, do you want to comment on that? Because I know you have a great experience with that.
Thanks, Katy. Yes, I think I think it depends on where you are. At UCSF, we have a caregiver group, and any caregiver is welcome. So we have mothers and daughters come together. We've had siblings come. So I think even though you might not be the primary caregiver, I think you can still benefit from going to a caregiver group. And another thing, another place where I know that caregivers have found information and support is attending the patient groups. So many of the patient support groups are actually open to family members as well. And so I know at UCSF we have a big group, and I would say friends attend, cousins attend, and caregivers and patients. So I think you're welcome at any of the groups. I guess my other tip would be always give a group maybe 2 goes, because so much of the way a group runs has to do with who's there on that particular day or evening. And so sometimes it might feel like an immediate fit. And sometimes you might want to come back one more time before you make a decision whether it's a good fit or not.
Thank you so much for your insight there. I will just add too, if you need help finding a support group in your area, please feel free to reach out to the ABTA. We have a support group locator on our website, and you can always contact the care line as well, and we'd be happy to give you a hand in finding some support in your area. I have a question here from one of our attendees for Lou. Lou, can you talk a little bit about how you coped with any negative or anxious thoughts you may have had or that may have occurred, especially at the beginning when you first learned about the diagnosis?
Yeah, that's a tough one. I'm not gonna lie. There were a lot of tears, of course, because it's scary when you hear that. I don't think you immediately, when you're not in this world, you hear brain tumor and you immediately think the worst. But we were very fortunate to be at Duke and very close to Duke. And it was so hopeful. And we knew we had the best care in the world. I mean, we literally had the best neurosurgeon, Dr. Friedman, take care of Bob. And we just felt everyone was so skilled, and that really helped us sort of push through that initial. But I think it's important to say that we allowed ourselves to cry. We allowed ourselves to feel all of those feelings, that gut-wrenching scare. It's scary. And then, we prayed a lot, and we got our family and friends to pray, and we felt it. And then just the incredible support that we got from the medical team, I cannot say enough for that. So that really helped. But I think just letting people know how scared you are and how sad you are, or what emotions you're going through, they will listen, they will care. Our providers were so wonderful about that. And then we leaned on each other. Bob and I leaned on each other.
Thank you so much for sharing your perspective and what helped you during that, Lou. Another question we have here is coming from someone who is a sole caregiver. This attendee was a sole caregiver for their spouse, and they really worked out a great working relationship of how to make that work. But then other family members would come in to visit, come into the picture, and would kind of interfere with what that dynamic that they already had set up. Could you talk a little bit about how to address a situation like this? How do you navigate that? Maybe Dr. Peters, if you want to start, and then Lou, I'd love to hear if you may have experienced something similar.
So I think I like to start this early on with the patient and the caregiver. So when I first meet a patient for the first time, I ask the patient to introduce me to the people in the room. So it sets up sort of what is the role of that other person to the patient? Like, how do they perceive it? The next is, it is okay to educate people about that situation. If you have a primary caregiver and they're having issues with another caregiver, it is okay to have a dialogue with them, as long as you can keep it friendly as much as possible. And this is when people like my social worker gets involved, when a psychologist gets involved. This is when nursing is also really important, because many times what can happen is we don't have just the primary care calling us, the primary caregiver, then it's also like a brother, a sister, a son, and they all have different questions. Sometimes it can be beneficial to designate one sole person. But again, I try to be open. I try to reflect the wishes of the patients' relationships with those caregivers and that circle of people. And really try to provide some civility to it when it's most likely, because usually everybody just wants to do good. I see for at least for my patients and their loved ones. Lou, do you have any thoughts?
I kind of had it easy in this sense right away because as soon as Bob was diagnosed and we knew he was going to have to go in for surgery, he made it clear to the entire family, his mom and dad and sister, that Lou is in charge. She knows my wishes. She knows what I want. And so she's in charge. She is number one. And there was never any question after that. They trusted that I was making good decisions on his behalf. And I think that was a really integral part of making it a lot easier as far as the dynamics went with the families, that they knew that I knew Bob's wishes and we were good to go. I hope that helps.
Yeah, that's really helpful. Thank you for sharing that, Dr. Peters and Lou. We have a question here. This one's for you, Lou. You talked about your daughters, your young kids. Can you talk a little bit about how it was sharing with them about the diagnosis, how their understanding may have changed over the years? And in addition to that, just how you guided them through some of those unexpected experiences that may have come up, like when scans are coming, if your husband experienced seizures, stuff like that. How did you navigate those conversations with your kids?
Yeah, that was a great question. And I'll be honest with you, the child life specialists are so amazing when it comes to this. And full circle moment, I have to tell you, my daughters are now in their 20s, and my youngest daughter was so impacted by child life specialists that she is now finishing her final semester in her master's program to become a child life specialist. And so that's how profound they were in our journey. But we were very careful to not use the word cancer with our kids. That's what Bob and I chose to do. It's important that you talk this through. That was just our point of view. We never used the word cancer with them. We told them that Daddy had, because they were very young, Daddy has a boo-boo on his head. He's going to go to Duke. There's some great doctors. They're going to help his boo-boo feel better, and he'll be home in a few days. And he was, home within 3 or 4 days. And, Daddy was a little different. Daddy was more tired, and we explained things as it went, but we didn't want them to be fearful. No matter what you do, there's going to be anxiety. They're going to have feelings, and it's good that they talk it out with you or a professional, to be honest with you. That was really beneficial to us. And we really stressed prayer and faith and our relationship with God in our family. And that helped tremendously as well. I hope that helped too.
Yeah, thank you so much for sharing how you kind of coped with this really as a family with your kids. Another question for you about that relationship aspect, and you kind of touched on this a little bit of, kind of navigating your relationship as a wife and as a caregiver. Can you talk about how you would separate between those two relationships and navigating that so you're still, playing your role as a wife, but also that role as a caregiver?
Yeah, it was a little easier prior to his stroke 2 years ago, because I felt like we were equals. And now I do really feel like I am more of the care. I almost feel like I'm a nurturer and almost a mom role sometimes. Like, I have to remind him, did you brush your teeth? Things like that. But at the beginning, it was, I let him see me cry. I let him see, because I felt like that was important for him to know that I loved him that deeply, that this was affecting me so much, and that it wasn't just him going through this, it was our whole family. It rocked our world. And I was affected by this, and he is the love of my life, and this is a hard pill to swallow. And I wanted him to know that. So he did comfort me at times. And I noticed the way our relationship was when he was strong, I tended to be, that was my weepy times, and vice versa. When he was very sad or blue, that was when I was my strongest. And And so it's kind of been a back and forth over the years. But like I said earlier, I do have to remind myself to just hold his hand as a husband and wife hold hands, and love on him like a husband and wife do, because there can be blurred lines there.
That's beautiful. Thank you so much. And we do just have a clarifying question. Some of our attendees are wondering, could you share what was your husband's diagnosis?
That might be easier for Katie, but so he had a anaplastic astrocytoma, left temporal lobe. I always point to it. It was a grade 3. He had a resection, a year of Tumor, which is, am I saying that right, Katy?
Yep, Tumor.
Oral chemotherapy, and then he had 6 weeks of radiation. He also 2 years later was diagnosed with a second cancer, and they found a sarcoma in his chest wall, and that was resected, and he had radiation on that as well. But over the years, the reason we would continue to have scans is that he would have seizures from time to time. He has had a few strokes over the years, we believe, based on the radiation. And so, who knows what it is exactly? I can't say one way or the other, and he has had a host of other health problems. He's on 17 medications. I think we have a team of 20 different doctors that I try to manage through my chart for him, different specialists for some of the different ailments that he has. For example, diabetes, high blood pressure, that sort of thing.
Oh, thank you so much. That is all the time that we have for questions for this session. Thank you again. I'll turn it over to Emily.
Yes, thank you so much, Dr. Peters and Lou, for this impactful session on the many facets of caregiving. It truly has been a pleasure to work with both of you and be a part of this program. And thank you so much, Lou, for your willingness to be here with us today, for your vulnerability in sharing your experience as a caregiver, and all the encouragement and advice to those that you shared with today.